Lilly wanted to better understand the unmet needs of people with migraine, so the company launched the Overcome study a few years ago. What is Lilly's Overcome study, and what did you hope to learn from it?
Yeah, the Overcome study is a very important study that has been conducted over the last several years, and it stands for the Observational Survey of the Epidemiology, Treatment, and Care of Migraine. And it involved over 60,000 people in the United States with migraine to really assess and better understand their treatment journey, what barriers they had to overcome to get to the care that they needed, if they managed to get to the care that they needed, and what is the status of the treatments that they've undergone, and how that's helped either help with their disability or perhaps lead to a need for different treatment.
What were Overcome's key findings?
Well, I would say that among the numerous findings that Overcome has provided for us, I'd say three that immediately come to mind are going to be that less than 30% of people in the United States with migraine are actually getting the kind of treatment that they need, whether that be an acute medication or a preventive medication. There are a number of barriers and contributors that are leading to the overwhelming majority of people not getting the treatment that they need. I would say one of the other important messages is that about half of people with migraine are hesitating to seek care for any one of a number of reasons. And I would say that one big contributor to that is actually the third message, which is about 1 in 3 people with migraine are experiencing some degree of migraine-related stigma, whether that be from their families or whether that be from coworkers or people at work. These are important factors that are really contributing to their overall kind of global disability that they're experiencing with their migraine disease.
From the findings, why do so few people take recommended medication?
Well, there's a number of contributors that lead to someone not taking the medication that they might need. And I would say that two of the more simple ones to just throw into the mix are their ability to be insured and get to a healthcare provider and get some type of prescription medication. Of course, that's going to be a contributor. But interestingly, also the degree of disability does contribute to whether or not they seek care from a provider. And those being more disabled are more likely to actually seek out a provider that's going to help them. Interestingly, that's a very important take-home point in that it's not about the migraine headache days that lead to someone seeking care. It's about the degree of disability that they have. So contrary to what a lot of us headache specialists like myself have believed, that larger burden of migraine days is what leads someone to come to my office and get treatment, it's really about how disabling is their experience. And when they get to that point where they can't function at work or they can't function at home, that's when they seek care.
What are the reasons a person with migraine does not seek migraine care?
Well, there's a lot of reasons why someone might not necessarily seek care from a provider for migraine. And I would say that among the significant and important reasons beyond being insured, beyond having the time to go see a provider, would be some of the more stigma-related reasons. A lot of people with migraine, according to the Overcome study, indicated that they didn't feel like their migraine was going to be taken seriously by their provider. And then you have another population of people who feel like they can take care of it on their own. And unfortunately, what that leads to is a significant portion of that migraine population that really suffers in silence, needlessly, when they should be going to a provider, and if they feel like their provider's not taking them seriously, to advocate for themselves, to explain what they're going through from an impact perspective, and to also legitimize, not just to themselves, but to the people around them, about the burden that migraine carries, especially because it occurs in people who are really at their peak contribution years in terms of age when they should be working, when they should be taking care of families, and understanding that that's when they should be functioning at their best.
According to Overcome, what types of stigma do migraine patients experience the most?
Among the numerous types of stigma that people with migraine experience, according to Overcome, two of the really unfortunate answers that we saw were that people without migraine, that among people without migraine, 15% felt that people with migraine were using it as an excuse to have some sort of secondary gain, whether that be to get out of some type of obligation or some type of work. And unfortunately, 30% of this group without migraine also felt that migraine wasn't a burden at all, that it actually should be very simple to take care of and treat. And unfortunately, people with migraine, they sense these things, they feel these things. They're the direct recipient of some of these sentiments. And so this is what leads to people showing up at work even though they're not feeling at their best, a phenomenon that we call presenteeism. And instead of getting the care that they deserve, they, again, just choose to endure the impact of migraine because they don't want to speak up, because they know how some of the people around them are feeling about it.
What does this mean for people living with migraine?
Well, for people living with migraine, I would say that all the lessons that we've learned and overcome really indicate that you need to advocate for yourself, to feel free and open to share the impact of migraine, and to seek the care that you need. When I talk about sharing the impact, I'm not just talking about the type of impact that someone has during a migraine attack, but also those other less noticeable components of impact that other people might not see. And that includes the worry about when another attack is going to happen. That includes the fact that people with migraine tend to change their plans or alter plans for fear of what's going to happen. Are they going to have an attack? What are people going to think of them if they know that they're not functioning at their best? Especially when they sense that stigma of migraine is just another headache, and that people don't really understand that migraine is actually a neurologic disease with a genetic basis. And that lack of understanding leads them to really hold back and not experience life the way that they really should.
What are ways to address migraine-related stigma?
Well, I would say that among numerous ways to address stigma, a lot of the solution comes to making sure that people who are treating people with migraine, the healthcare providers that are really on the front lines, the primary care providers, sometimes even the general neurologists, that they understand that, number one, migraine is a legitimate neurologic disease, and that the headache, the thing that we always consider to be really the essence of migraine, is actually just one of many symptoms of this disease. And that it's treatable. I think a lot of times there are providers and there's even patients who may just throw up their hands and just say, well, there's not really much I can do about it. When in fact, there are a number of things, there are a number of treatments that are recommended by the American Academy of Neurology and recommended by the American Headache Society as being effective for treating migraine. A lot of that solution is going to be in being honest about what kind of burden do you carry, how many migraine headache days do you have, and how much of a burden are you experiencing from them? What is the degree of disability that you're experiencing from them, so that your provider knows whether or not they need to take action by initiating acute treatment only or acute and preventive treatment to help you function at your best.
How can people with migraine prepare for conversations with their healthcare providers to ensure they are accurately relaying the full impact the disease has on them?
Well, probably the best advice that I can give someone to prepare for a meeting with their provider about migraine is going to be honest with yourself first and really think about how many headache days do you actually have. I know that I'm not alone when I say that there's a number of headache providers that have had patients that they talk about the severe days. They talk about the days that they associate as migraine headache days, and they begin to forget about all those other days that they have headache, or that they're not feeling well, or that they're having other symptoms of migraine. And they tend to compartmentalize those into days where they feel pretty close to normal, and they start to not give those days as much importance as these other days. And so they underreport the number of days that they're impacted. So number one, all those days matter, because when a provider starts thinking about when to initiate treatment, those days go into the decision-making process. And I would say the other thing is to be honest about the degree of disability that those days are imparting on your life. Are those days resulting in missed work? Are those days resulting in missed time with family or other missed obligations? Because those are important factors that are going to help your provider know when to initiate treatment. One other important initiative that I know we are so proud to be a part of is the Think, Talk, Treat Migraine program, which really helps to address a lot of the clinical care gaps in migraine. The two big clinical care gaps that we're working on right now with the general neurology population is that 56% of people who have migraine are on are not on a preventive medication when they need it. And then the other is that 50% of people with migraine are not discussing impact in their visits. And unfortunately, it's that discussion about impact which does lead to the neurologist knowing when to take action with preventive treatment. In a previous version of T3, which was more directed towards primary care, we added on the clinical care gap that a lot of people with headache were not being recognized as having migraine. And we're going to a provider and we're being felt to have perhaps sinus headache or some other type of headache, like tension headache, and therefore not getting migraine-specific therapy. And so between these two versions of T3, what we looked to do was really narrow that gap. So making sure that people got the treatment that they needed, were having the discussions that they needed, and were having the correct diagnosis given to them so that they could get those treatments. Think, Talk, Treat Migraine has really been innovative in that it's not about a traditional educational program as a lot of us are used to. It's really more of an activation program, because we really believe that providers at all levels, primary care, neurology, headache specialists, they all have the basic knowledge to initiate basic treatments for migraine. And patients already have the education of what they're experiencing. They know what their life experience is and what their migraine journey has been. But for some reason, those two dots are not getting connected. And so it's really about activating the knowledge base of the provider with the experience of the person with headache and migraine to actually have the right conversations to initiate those knowledge bases and to convey that information that leads to better treatment.
Can you elaborate on Think, Talk, Treat Migraine? How does the program help in better conversations between patients and doctors?
Well, the Think, Talk, Treat Migraine helps with those conversations to connect patients with migraine to providers who treat migraine by helping them both speak a similar language. I know that having been on both sides of being a physician and a patient, that sometimes we're not on the same page, and a lot of that can be overcome by just saying the right things. So when people with migraine come in as patients, to really discuss not only the burden of their disease in terms of headache days and impact, but to also be very forthright with their providers about, I'm not feeling well, I need some type of treatment, I need to be functional at work, I need to be functional at home. And then it also includes the providers knowing how to speak the language of their patients and knowing that, to dissociate themselves just a little bit from their HCP selves, from their provider selves, and know when to say, okay, tell me more about the impact that migraine is having on you. And asking these types of open-ended questions that actually don't take much time for a patient to answer, that just reveal a ton of information that can really help decide when and what kind of treatment to initiate.
If you had to give people living with migraine one piece of advice, what would you suggest?
Oh gosh, that's a challenging one. There's so much great advice to give people with migraine, and this is coming from a provider. What do I wish my patients who used to come to clinic to see me, what did I wish that they would do more? And I would say that it would be to expect better care, to not feel like okay is okay, that even if they're not getting the full degree of impact from a treatment that they expect to where they can function again, to feel open and honest, to come back and say, I don't think this is working for me. I need to try something different, or I need to be more aggressive with my treatment. And I think providers want to hear that. I mean, at the end of the day, I know that providers want the best for their patients, and I know that they want people to feel better, but unfortunately, we can only act on what we hear. So again, it's really about being honest with yourself. How many days are you truly experiencing impact? Not just the severe days, but all days. And are you conveying that information to your provider, and are you expecting the best for yourself, knowing that migraine is a legitimate disease that needs to be treated like a disease and needs to be legitimized as a serious public health concern?